what we've been doing here at Montefiore and at Einstein is we've developed a combined program between high-risk MFM and cardiology. And my role is one of two other cardiologists, and I deal primarily with adult women who were born with congenital heart disease who are now pregnant. And in this combined program, I bring my expertise from the world of congenital heart disease as these women are progressing through pregnancy. And we have a collaborative clinic with the high-risk MFM group, and we make delivery plans. We decide post-delivery where the patients are going to be managed, what is a risk assessment, and how do we mitigate those risks during pregnancy, at the time of delivery, and then post-delivery. Now, congenital heart disease in the world of pregnancy is the #1 lesion now with women with cardiovascular disease who are pregnant. So if you look all comers for women with the cardiovascular disease, congenital heart disease is the most prevalent. So if you think about that, I mean, those are thousands of women with congenital heart disease who are now pregnant. The prevalence of congenital heart disease in adults is now, if you take a broad scope number, it's about 1.2 million patients who are adults, so 18 and over, who have congenital heart disease. So when you think about the different forms of congenital heart disease, there are really three different spectrums. There is mild, intermediate, and severely complex congenital heart disease. These could vary from anything from holes in the heart, like atrial septal defects or ventricular septal defects, that are either present or have previously been surgically repaired. So these patients have lived with open heart surgery when they were infants, and they're now adults. They can be more complex lesions like tetralogy of Fallot or transposition, where in essence you were born with cyanotic congenital heart disease. So these infants were blue babies, and they had multiple open heart procedures when they were 1 month infants, maybe a couple of years old, and now they're older. And they're now dealing with the residua of those open heart procedures. And then there's severely complex congenital heart disease. So in essence, what we call single ventricles. So most of us who are born have 2 ventricles. And there are some patients who survive with a single ventricle, basically what's called a Fontan physiology. Those are the most complex lesions out there. And those women with single ventricles get pregnant. And then we make a plan and we decide how to get them through it. So I don't deal with chest pain and coronary artery disease as much as the average cardiologist. You come to my clinic and you can see someone with a hole in the heart, you can see someone with a single ventricle, you can see somebody with what's called a coarctation, where the aorta narrows. So the spectrum is tremendous, and it's fascinating because you throw pregnancy into that, and now you've got a whole other gamut. There are only a handful of lesions, maybe 3 or 4, which we consider as severely high risk. And those are the patients that we would probably advise against pregnancy. Invariably, most women with congenital heart disease can get pregnant. They can carry a child. They can get through the 9 months of pregnancy. They can get through delivery and then down the road. But there are only a handful of lesions that we would say don't get pregnant with. Now, I'm going to take you back 30 years ago. 30 years ago, when these kids were younger, and we were, let's pick the 70s. Several of my mentors were from that genre, so they'll probably get mad at me when I say this. But back then in the 60s and the 70s, these children were growing up with congenital heart disease, not knowing what the long-term outcomes were going to be, and these children were being advised not to get pregnant. These children were being advised not to play competitive sports. These children were being advised, you should have a nice, easy lifestyle. Now, in this day and age, when I see these patients, I'm like, well, it's a risk assessment. Let's assess your risk. And based on that risk assessment, we will get you through what needs to be done, be it a job, be it sports, be it pregnancy. Because my job as an adult congenital specialist is to make sure that my patient can have as normal a life as the next person. So congenital heart disease in adults has come such a long way. And that's really where it's going. That we now, I can tell you probably on one hand how many women I've said don't get pregnant. I mean, it's minuscule.